Overall cases continue to fall, but provincial health officials are anticipating caseloads to carry more of the B1117 variant later this month.
The variant behaves as it did in the United Kingdom. Cases will start to grow here again in late February or early March.
New modeling data is showing improvement when it comes to case counts, hospitalizations, and reduction in deaths across Ontario, but found that 5 to 10% of current cases are likely the UK strain. And based on the spread in Europe, it has the potential to triple. But there is some positive news as well.
From what we can tell so far, the vaccines we are using in Ontario today work against these new variants.
The province says with aggressive vaccinations and stay-at-home measures, Ontario could stave off a potential third lockdown this spring. But this comes in the wake of the Ford government announcing that regions outside the GTA will head back to the color-coded framework, where some non-essential businesses will be allowed to open.
You have to be very careful what you mean by starting to mobilize a bit and move a bit with all the precautions in place. So we're not opening up. We're allowing some things to be available.
Many experts believe that the UK variant is much more contagious, particularly in young adults and children, and possibly more deadly. When asked about a potential pending disaster, Ontario's health officials had this to say.
The cases will likely rise given the variants of concern. The need to keep that R down is really, really critical. But there are a number of things that need to be weighed in making these decisions.
Now, Dr. Brown didn't elaborate on what those things that they needed to weigh are. Now, it is expected tomorrow that regions like Hamilton and the surrounding areas will find out which colored zone it will enter beginning next Tuesday.